You take about 15 breaths every single minute, and most of the time you don't even think about it. But what happens when that simple automatic act goes wrong? Well, today we're going to take a tour of the gatekeeper of your breath, the upper respiratory system. We're going to look at everything from a simple nosebleed to much more serious conditions and see how it's all connected. Let's dive in. So let me just ask you this. What could a random nosebleed, your partner snoring, and that absolutely miserable week you spent laid up with the flu, what could they possibly have in common? I mean, they seem totally unrelated, right? Well, it turns out they are way more connected than you think. The common thread, the one thing that ties them all together, is your upper respiratory tract. This whole system, from your nose all the way down to your voice box, is literally the front line for every breath you take. And because it's the first point of contact with the outside world, it's also where a lot of common health problems get their start. So, here's our roadmap for today. We'll start at the top with the nose, looking at nosebleeds and blockages. Then we'll move down to colds and the flu, tackle the threat of sleep apnea, put a spotlight on larynx cancer, and wrap it all up with some key takeaways for protecting your health. All right, first stop on our tour is the very gateway to your body, the nose and sinuses. This is where all the air you breathe gets filtered, warmed up, and humidified. It's also ground zero for some super common and sometimes pretty painful issues. Ever had one of those nosebleeds that just comes out of nowhere? Well, the fancy clinical term for that is epistaxis. And a lot of the time it's caused by something as simple as dry air that cracks the delicate membranes inside your nose. But it can also be a sign of other things like an injury or even high blood pressure. And if you do get one, the fix is thankfully pretty straightforward. Now, the most important tip, and this is one a lot of people get wrong, is to lean forward, not back. You don't want to swallow the blood. After that, just apply some direct pressure and maybe an ice pack to help shrink those blood vessels and stop the bleeding. You know that feeling of a stuffy nose that just will not quit? Well, it might not be just another cold. It could actually be a structural issue. Two really common culprits are a deviated septum, which is where the wall between your nostrils is a little off-center, and nasal polyps, which are these harmless growths often tied to allergies. And as you can see, fixing them might eventually require surgery. And then, oh, that dreaded pressure and pain right in your face. We're talking about sinusitis. All this is an inflammation of the lining in your sinuses. When that lining gets all swollen, it traps mucus and air inside, and that's what causes that signature awful pain over your cheeks, your forehead, and around your eyes. The good news is, you've got a pretty solid toolkit for managing sinusitis at home. Things like saline rinses, decongestants, and warm compresses can bring a ton of relief. Of course, if it's a bacterial infection, that's when you'll need to see your doctor for antibiotics. Okay, let's move a little deeper into the system, past the sinuses and into the pharynx and larynx. That's your throat and your voice box. This area is basically ground zero for some of the most common infections we all have to deal with. So here we go. The question we all ask ourselves, is this just a cold or is it the flu? Honestly, the biggest giveaway is how it starts. A cold kind of creeps up on you over a few days. The flu hits you like a truck. All of a sudden, you've got a high fever, severe aches, a pounding headache. And knowing the difference really matters because the flu can be a much more serious deal. But here's the really encouraging part. Influenza is largely preventable. It really just comes down to 3 simple but super powerful steps. Get your yearly flu shot, be really good about washing your hands, and, as we've all become experts in recently, try to avoid close contact with people who are sick. Okay, now let's shift gears and talk about a disorder that messes with the whole system, especially when you're most vulnerable, when you're asleep. We're talking about sleep apnea, and it's a condition that is way more serious than a lot of people realize. So often, we just dismiss loud snoring as, an annoyance, something to joke about. But heavy, disruptive snoring can actually be the most obvious sign of sleep apnea, a condition where a person literally stops breathing, sometimes hundreds of times in a single night. And this is why it is so incredibly dangerous. It's not just about getting a bad night's sleep. Every single time you stop breathing, the oxygen levels in your blood plummet, and that puts a huge strain on your heart and your brain. Over time, this is directly linked to major health problems like heart disease, stroke, and high blood pressure. So what's actually going on? Well, the most common type is obstructive sleep apnea. This happens when the muscles in the back of your throat relax a little too much during sleep and physically block your airway. The biggest risk factors are obesity, which adds extra tissue around the airway, and smoking, which constantly irritates and inflames it. Treatment often kicks off with lifestyle changes like weight loss, but really, the gold standard therapy is the CPAP machine. It just gently blows air into your airway through a mask to keep it open while you sleep. For some people, surgery to remove that extra tissue might also be an option. Now, we have to turn to the most serious condition in our journey, cancer of the larynx, or your voice box. This is a disease where catching it early is absolutely critical for saving not only a person's voice, but their life. Larynx cancer starts in the lining of the voice box, and the two biggest risk factors by a long shot are smoking and heavy alcohol use. But the most important thing to take away from this, the key warning sign, is persistent hoarseness or a change in your voice that just doesn't go away. And this really shows the profound, life-altering impact of the main surgical treatment. It's called a laryngectomy, and it removes the voice box. Before, you breathe and speak normally. But after, breathing happens through a permanent opening in the neck called a stoma, and you have to learn entirely new ways to speak. It is truly life-changing. Wow, we've covered a lot of ground, from the very tip of the nose all the way down to the larynx. So after that whole journey, let's pull everything together and focus on the most important takeaways for protecting this incredibly vital system. Okay, let's boil it all down to the absolute essentials. First, know the difference between a cold and the flu so you can take influenza seriously. Second, never ever ignore a change in your voice or a hoarseness that lasts more than a couple of weeks. Third, please understand that heavy snoring isn't always harmless. And finally, never forget the direct, powerful link between smoking, alcohol, and the risk of throat cancer. Every single breath you take is a gift from this complex, delicate system. It works around the clock, silently protecting you day in and day out. So the final question I'm going to leave you with is this. Now that you know a little bit more about how it all works, how will you protect it?